On World Health Day 2026, global leaders gathered in Lyon, France for a milestone event, the One Health Summit. This gathering marked a pivotal moment as the World Health Organization and its partners announced a series of high-impact initiatives. The summit's theme, Together for Health, Stand with Science, set a collaborative tone. Leaders from around the world, including heads of state, ministers, and experts, united to address the urgent health challenges facing people, animals, and the planet. Their goal was clear: move from vision to action, ensuring a safer, healthier future for all. Urgency for a One Health approach has never been greater. Climate change, environmental degradation, unsafe food, water contamination, and biodiversity loss are just some of the pressing issues we face. These challenges are deeply interconnected, affecting humans, animals, and the environment alike. In fact, about 60% of known infectious diseases in humans originate from animals, and 75% of emerging diseases are zoonotic. The COVID-19 pandemic alone underscored these risks, causing immense loss and disruption worldwide. Addressing these threats requires a united, science-driven response. One Health approach recognizes that the health of people, animals, and the environment are inextricably linked. This means we cannot protect one without protecting all three. By breaking down silos and encouraging collaboration across sectors, health, agriculture, environment, and science, One Health aims to detect risks earlier and respond more effectively to threats. This holistic strategy is essential for preventing future crises and ensuring sustainable well-being for generations to come. France played a leading role as the summit host, reaffirming its commitment to advancing the One Health vision. President Emmanuel Macron emphasized that One Health is about more than just protecting health, it's about recognizing our shared system, where the well-being of humans, animals, and the environment is inseparable. France's determination to move from ambition to implementation, guided by science and strengthened by international cooperation, was clear throughout the summit. Summit brought together a diverse group of leaders, heads of state, ministers, experts, and policymakers. Their coordinated efforts are strengthening international dialogue and mobilizing both public and private partners. The outcomes of the summit will inform ongoing discussions, including those at the G7, ensuring that preparedness and coordinated responses to health threats remain at the forefront of the global agenda. One of the major announcements was the creation of a new global network of One Health institutions. This network, formed by WHO and its Quadripartite partners, aims to deliver the objectives of the One Health Joint Plan of Action. By mobilizing multidisciplinary expertise, the network will provide coordinated support to countries, translating global guidance into practical tools and on-the-ground action. Training and peer learning will be strengthened, creating a clearer, country-focused delivery model. Science remains at the heart of the One Health movement. WHO and its partners announced the extension and expansion of the One Health High-Level Expert Panel, OHHLEP, the world's leading scientific advisory body on One Health. With a renewed mandate through 2029, OHHLEP will shape the global research agenda, support the Joint Plan of Action, and drive high-level advocacy grounded in evidence. This ensures that all actions are informed by the latest scientific knowledge. Renewed global initiative was launched to eliminate dog-mediated human rabies deaths by 2030. Rabies still claims nearly 60,000 lives each year, many of them children. Led by endemic countries, this initiative will boost political commitment and community-based surveillance. By using rabies elimination as a model, the program aims to strengthen broader One Health surveillance and preparedness systems, protecting both people and animals. Another key initiative is the new strategic framework for collaboration on avian influenza. This framework, presented by WHO and its partners, strengthens coordination on surveillance, risk assessment, preparedness, and response. By shifting from fragmented actions to a unified strategy, countries can better address the wide-ranging impacts of avian influenza on public health, food security, livelihoods, and biodiversity. WHO is now assuming the chairmanship of the Quadripartite collaboration, taking on an enhanced leadership role for coordinated global action. Alongside FAO, WOAH, and UNEP, WHO will focus on delivering measurable impact at the country level. This includes streamlining governance, aligning efforts around high-impact priorities, and further strengthening advocacy, norm-setting, and evidence generation. Alongside the summit, WHO launched its first global forum of collaborating centers. This event brought together high-level representatives from over 80 countries, including ministers from France, Germany, Indonesia, South Africa, and Japan. More than 800 WHO collaborating centers participated, making it a truly global platform for accelerating scientific innovation, data sharing, coordinated research, and capacity building. Global Forum serves as a forward-looking platform to deepen collaboration among leading academic and research institutions. By fostering scientific innovation, sharing data, and coordinating research, the forum aims to build capacity and drive progress in tackling complex health challenges. This collaborative spirit is essential for translating the One Health approach into real-world solutions. Both the One Health Summit and the Global Forum send a clear message. Today's complex health challenges demand stronger multilateral cooperation. Greater investment in science and sustained efforts are needed to translate the One Health vision into concrete action at both global and local levels. By working together, countries can build resilience and better protect people, animals, and the environment. Outcomes of the summit and forum will inform ongoing international discussions, including those at the G7 and beyond. With WHO's leadership and France's commitment, the world is taking concrete steps to prevent future health crises. The focus remains on measurable impact, science-based action, and unified strategies that benefit all humans, animals, and the planet. Ultimately, the One Health approach is about shared responsibility. Protecting health in a connected world means recognizing our interdependence and acting together. As the world moves from vision to action, the commitment of WHO, France, and global partners offers hope for a healthier, more resilient future. By standing with science and working in unity, we can meet the challenges ahead and safeguard the well-being of all.
Ace your medical exams. Study smarter with Scrolls MD. Scrolls MD is your all-in-one app for medical students and doctors worldwide. Dive into thousands of high-yield MCQs with detailed explanations, smart flashcards using active recall and spaced repetition, plus condensed notes and full-length mock exams. Prep for USMLE, PLAB, and CCQE, AMC CAT, NETPG, and more. Import Anki Dex, track your progress, focus on weak areas, and study offline with dark mode. Thousands trust Scrolls MD to build mastery and crush their exams. Download now and study smarter with Scrolls MD.